Let me start by saying that we need to focus on what exactly achieved in the Nigerian health sector. There are two fundamental issues: to deliver quality, patient-centered, respectable care, both in the public and the private sectors, on the one hand, and secondly, to ensure access to this quality patient care by all Nigerians, what is basically referred to as universal health coverage. Among other things, the cornerstone of achieving that involves both the workplace environment in terms of infrastructure, diagnostic, what is available for prevention, investigation, and for treatment. But very importantly, the manpower for health, ranging from doctors, nurses, other healthcare providers, including community health extension workers, pharmacy technicians, and so on and so forth, at the primary care level through to secondary and tertiary care level. What we have seen in recent years is a mass migration of doctors, nurses, and indeed many healthcare providers out of this country to more lucrative developed countries in the West, as well as the Gulf states. These are mainly push factors that make them leave this country greener pastures. These push factors center around the workplace environment itself, as well as the conditions of services that ensure the well-being of these care providers. Unfortunately, the whole world will see a deficit in healthcare providers to the tune of about, I think, by 2030, which means what's going to happen is that countries that can offer the best conditions of service in terms of both workplace environment as well as the well-being will compete at a very great advantage against low middle income countries like Nigeria. This would result in a dwindling population of healthcare providers, and in a country like Nigeria, versus an increasing population, further worsen the doctor-patient ratio, which is 1 to 600, as recommended by the World Health Organization, but currently stands at about 1 to 5,000. And this would most likely be in our urban centers that have more proportion of doctors. This is more likely to be a lot more in our rural areas, where there is an uneven and inequitable distribution of both health facilities as well as manpower. The exact figures of these numbers is very dynamic, but suffice to say that a large proportion of people, including Nigerians, who move out of their countries for medical needs in developed Western countries such as the United Kingdom and the United States, and end up a lot of the time Nigerian doctors who were trained in this country, who could provide and provided these best quality services to our citizens, but who have been taken up by other countries to provide services to their own citizens.